What if I told you that there is a 10-year window that significantly impacts how you age? Your heart, your brain, your bones, your muscles, your skin. A lot of women have no clue about it, and they totally miss the 10-year window. So I'm Dr. Morgana Colombo, board certified dermatologist, founder of Vida Derma, and today I'm going to talk about HRT, Hormone Replacement Therapy, and how that can be beneficial to you in your aging journey and significantly improve the whole aging process if done in the right time, in the right patient. So menopause is not just about not having any more periods. It affects a lot of organs in your body, your cardiovascular system and blood vessels, your brain and cognitive function, skin, hair, nails, affects your muscles, your bones and fracture risk. So as estrogen declines and you go through menopause, a lot of, I would say, negative changes happens. Your skin becomes thinner as you start losing more collagen. There's increased cardiovascular risk. There is bone loss and even higher increased risk of like fractures. There is muscle loss. There are some metabolic changes such as increased insulin resistance, more unfavorable lipid panels. There are also cognitive changes such as, increased memory loss, psychological changes, increased risk for like depression, anxiety. So a ton of like negative changes happens as you hit menopause and lose your estrogen. So HRT is not just about treating hot flashes. If used appropriately in the right person, it can significantly improve your life and affect in a positive manner your lifetime lifespan. So what are some of the benefits of hormone replacement therapy in women? So back in the day when that Women Initiative study came out in the 90s, everybody thought that HRT was the devil, so horrible, increased your risk of like heart attacks, strokes, cancers, and it was black labeled and pretty much not even taught in medical schools. Doctors stopped prescribing it, but more recent evidence has showed that was not true. There are a lot of flaws with the original Women Health Initiative studies, especially the fact that a lot of the women looked at in those studies, they were much older, they were greater than 60 years old, and they were on high dose oral types of like estrogen and synthetic progesterones, which can lead to, some of those things that were seen back then. But more recent evidence does not support that. And if anything, maybe even the opposite of that, to the point that the FDA just recently sent out a statement asking for the black label on estrogen, progesterone, HRT formulations to be removed, and for us to really just clarify all of that. So some of the benefits of HRT that we now think exist are when it comes to your cardiovascular system, it may actually support healthier arteries and improved cardiovascular health if started earlier, within 10 years of menopause or before age 60. It may actually also support brain health and improved cognitive function and decreased risk of dementia, again, if started early. If you start later after age 60, that's not the case. The other benefit is when it comes to bone. Estrogen promotes bone, so more stronger bones, less risk of fractures. That's another benefit. Supports muscle development, so improved muscle function, which increases your bone function, and also improved muscle mass leads to better metabolism, so better insulin sensitivity and improved lipid panels. And it also has beneficial effects on the skin. You know, it's my specialty. So estrogen promotes collagen and elastin, which leads to increased dermal thickness, so thicker skin. And it also promotes hydration and healthier skin barrier. So what we now think is HRT may actually improve your skin crepiness as you get older and just make your skin look better. And also may help your hair. So that's another benefit. And it has also a lot of benefits when it comes to how you feel. So it decreases insomnia that happens, you know, around menopause, decreases hot flashes, night sweats, improves your mood, may decrease the risk of depression and anxiety. So a lot of benefits of HRT. So I talked about all the benefits of HRT. So should then everybody be on it? No. I'm not saying that, guys. So HRT needs to be individualized. It needs to be assessed on a patient by patient basis. It's not one size fits all. It's individualized treatment based on your, health history, family history. So when it comes to potential risks of HRT, you do have to keep in mind, so there is increased risk of cardiovascular events if started late in menopause, like after age 60. And also likely that risk is higher in patients that have, cardiac history, personal history, or family history. There's also increased risk of endometrial cancer when estrogen is given unopposed without progesterone to protect the uterus. For people that have had a hysterectomy, then, no risk of, endometrial cancer. There could be increased risk of breast cancer if it's used for, long periods of time, and more than 10 years. Especially in patients that have a family history of breast cancer. And it's not the estrogen that actually increases the risk, it's the type of progesterone that actually seems to increase the risk. So the more synthetic progesterones seem to give a higher risk. And then the route of delivery of estrogen seems to matter. So transdermal seems to be better, of course, than oral type of pill. Going back to the type of delivery of estrogen, that also matters when it comes to cardiovascular risk factor. So transdermal seems to confer less risk than oral types. And the other risk that can happen, of course, with estrogen, HRT, is increased risk of blood clots. Again, people with family history, personal history should not be on it. And the risk is higher with oral versus patch type of estrogen. So there are definitely risks. And with that we just have to look at the whole person, look at their history, their behavior. So smoking, obesity are going to increase your risk of having complications. So it's an individualized approach, but in the right patient, it can be very beneficial in improving the aging process. So a common question that I always get and doctors get when it comes to HRT is, what's the best time to start it and how long do you stay on it? So recent evidence seems to point towards earlier start seems to confer more benefits when it comes to cardiovascular, brain and bone, health and benefits there. So you want to start at late perimenopause, early postmenopause, but definitely, within 10 years of menopause before age 60. That's when you seem to get the more benefits from being on HRT. So I would say like age 48, 49, to like 54, around menopause. Those seems to be the kind of like the soft spot when it seems to like good timing to achieve like a lot of benefits from being on HRT. How long do you stay on? Do you stay on it forever? So we don't really know that answer. You have to be reassessed as time goes by. As you get older, particularly after age 60 or 10 years after menopause, if at that point you have cardiovascular risk factors, or you're not really gaining any benefit from being on it anymore, then it may be wise to stop. Some people may be okay staying on it indefinitely. So it's a case by case decision, and that requires constant monitoring and reassessment by your doctor. What is the best delivery method of HRT? So based on current evidence, it seems like the best approach would be the lowest dose that, works for you and gives you the benefits you're looking for. I tend to favor the combination of a transdermal estrogen patch, which you can start, at the lowest dose once a week and sort of titrate up to results. And you pair that with a bioidentical micronized oral progesterone, if you still have a uterus, for uterine protection. And so that approach of transdermal patch, micronized oral progesterone daily seems to be the safest approach with the least side effects, still with lots of benefits for women. Some women don't want to go systemic, so if you decide to just treat, let's say, the genital urinary syndrome of menopause, the UTIs, vaginal dryness, then estrogen gel or cream vaginally a couple times a week seems to do the trick for that. And the one thing with that is, because there's no systemic penetration of the estrogen, you don't need to take progesterone. So let's get more in depth when it comes to HRT and skin. So is HRT enough for aging of your skin? And the answer to that is no. It does not substitute good skincare regimen, treatment if you want to reverse things, good diet, exercise, good sleep, especially now when it comes to exercise, strength training. So it doesn't address everything that happens to your skin as you age. Skin aging is not just estrogen loss. Other factors play a role in it, such as your genetic background, sun exposure in the past, lifestyle, such as exercising, diet, stress. So, aging of the skin involves multiple factors. So one thing's not gonna reverse it, but HRT definitely is beneficial and can support, more production of collagen and elastin. It is a tool that can be used in conjunction with other tools. It definitely does have benefit when it comes to elastin and collagen, even in the low dose patch formulation, or even as a topical, estradiol topical. It can promote collagen and improve hydration and barrier. But again, it needs to be combined with other things. So you still need your good skincare with your daily sunscreen, your active ingredients to promote health, such as antioxidants. I love vitamin C, ferulic, vitamin E, resveratrol, also your peptides, potentially growth factors, and of course our golden ingredient, retinol, And, you still need good barrier support with, your ceramides, hyaluronic acid for more hydration. So you still want your good skincare regimen on top of your HRT. And to really reverse changes, your treatments they're still going to be good for you, such as your lasers and tightening devices. And again, lifestyle is everything. So strength training, unbelievably important in your aging process. It will keep your skin younger. Good sleep, less stress, healthy diet, it all plays a role. So HRT may support your skin as it ages and give it some advantages, but if you want to really do all that you can, you combine with all the other things. So it's multi-modality approach. In summary, HRT can be very beneficial to the right patient if started within 10 years of menopause, ideally late perimenopause, and definitely before age 60. If given as micronized progesterone, estrogen patch combination, that seems to be the ideal combination. It can definitely be beneficial to your cardiovascular health, brain, muscle, bone, skin health. However, you need to be constantly assessed and reevaluated. It's an individualized risk-benefit situation, but in the right scenario, it seems to really be something that can significantly improve your aging process.